To the United States, the whole world trying to grapple with the transmission of coronavirus, getting a sense of how serious it is. In the meantime, some places are panicking, including the market. Yesterday, the single biggest drop in the Dow, point-wise, in the Dow's history. For more on all of this, we turn to James Carafano, who joins us here live at CPAC. He's the Homeland Security expert and Vice President of Foreign and Defense Policy Studies at the Heritage Foundation. And as always, James, good to talk to you. This time, good to see you as well.
Oh my God, it's amazing. You're living human beings. You look a little weird in the level 5 containment suits, but other than that, it's kind of cool.
Well, we're deeply paranoid about this.
Well, I wear that all the time around Vince anyway, so I'm kind of used to it.
That's right.
Mine's pink.
So, what are your thoughts and feelings about this coronavirus?
Well, I mean, I think there are two things we can talk about: the response, and then we can talk about the politics, the policy of it. Which to me, I'm as a professional I'm just appalled. This is a public health issue.
Yes.
This is the absolute, for me, the only issue where politics ought to be out of bounds.
Yes.
Right? Because people need to know what's going on, and essentially to treat this as the new Stormy Daniels, which is what we have done. We have had no deaths in the United States.
That's right.
We have had no mass outbreaks, and essentially treat this like this is the end of the world. It is so blatantly partisan, and it's okay. I get that. You hate this guy. You want to take him down. It's the Mueller report. It's this. It's you. But on this one,
well, you're right. It's so decadent and silly. We were just talking about this moments ago that you have Democratic critics of the president who are upset that there was only one woman public health official during the presentation this week.
You know, my favorite. I don't want to name names because I do policy, not politics. No, I don't want to name names. But Speaker Pelosi gets up and says, "This is not about politics," and then literally rants for the next 10 minutes, saying things which are blatantly partisan and political.
Yeah. Very stupid.
It's like, it's life imitating art. It's all the wacky stuff that you see in these sci-fi movies. Why are people doing this?
Right.
It's just so wrong. And the reality is, look, we're going to have a flu season. The flu season is going to die away. My guess is we're not going to have a mass outbreak in the U.S. by the end of that. And they'll just forget about it, and they'll move on to the next big thing.
Well, that seems to me what we do. We go from crisis to crisis, and I've said this several times. I can remember, what was it, 2 years ago? We were all going to die from Ebola. Right? Right. That was, maybe it was longer than 2 years ago. All right. So it was like 5 years ago. We're all and nobody's bleeding from their eyes. I don't know anybody who started bleeding from their eyes. We're all going to die of Ebola. Now I'm hearing this. And listen, we're here at CPAC, which is just a virtual petri dish of conservatives. And there's hand sanitizer everywhere. And I'm going to have no skin left because I'm constantly bathing in it. But then I'm getting on a plane tomorrow.
Right.
And I'm going to be in a resort for a week.
Right.
And then I'm getting on a plane again. And I said to my husband, I'm like, should I just throw in the towel now? You know, and just put in for the days that I'm going to be sick. So is this real, or are we just overreacting as we always do?
Well, here's what we don't know.
That's
because
right.
when you look at these statistics, the mortality statistics are actually higher than the normal flu. Depending on whose statistics you like, it's normal flu's at somewhere between 0.1, 0.5%. This is higher than that. But
by many factors. It's in the 2% range. Yeah.
Right. 2%. But that includes literally every case in China.
Yes.
Where you have to really wonder, was it that this was a particularly virulent flu, or was it that they just had really crappy healthcare?
Right.
And if you look across the data that we've seen now, when it gets into the developed countries, it kind of looks to me more like crappy healthcare. Mm-hmm. And it'll be really interesting in the next week or so, because we've seen a wave of new infections as it's kind of gone global. If that's right, we'll see a wave of people essentially being cured or coming out.
In other words, in order for us to get an accurate sense of the threat, we need a bigger window of time to see how it diminishes in developed countries.
So here's what I think from a geopolitical perspective, what I really watch is the Middle East, because I think the Iranians will do a crappy job containing it.
They've already done it.
They've got
their senior public health official has it. Their vice president.
I'm sorry.
Their vice president has it. I mean, how far are we from like the president having it in Iran?
Your words to God's ears. But here's
one thing I
it's
told.
not.
That's
But
what you really
it's
want.
not. But I mean, the Iranians have poor health care to begin with, and but it's going to break out of Iran, and it's going to get into the refugee camps. And so you go to a refugee camp in Syria. If you don't get killed by a bomb, you're freezing. You've got almost no food. You're living. If you've got a tent, you're lucky.
Not good for immune system.
Any flu.
Yeah.
Any communicable disease that gets into something like that's going to be dangerous. But that's going to be a destabilizing factor across the Middle East. That's probably, I would think, the number one concern we have to have right now.
So if it's about the quality of health care, why are we seeing panic in Italy? Have you seen this? They've cleaned out the store shelves like there was a prediction in D.C. of an inch of snow.
Yeah.
You know, it was crazy. They're absolutely panicked. Why?
Well, I don't know, quite honestly, because again, even if it was a widespread epidemic, and you didn't want to catch the flu, there are so many techniques of just normal social distancing, washing your hands, not touching your nose, not touching your ears, not touching your eyes, going in a grocery store and just wiping things off before you consume them. The relatively simple measures that you don't have to lock yourself in your house and get a shotgun and have very low likelihood of catching the flu from somebody.
All right, so they're just panicking, which is what the president. To get back to the beginning of this, is the president yesterday saying, "Look, we've got to get hold of this." And Vince made the point earlier that the job of the president also is to kind of like tamp down any kind of panic and to be realistic and sober about something. Which the Democrats, of course, go the opposite direction and are pulling the fire alarm because they pull it on everything. So was the president right in saying, "Look, we're coming out of flu season, April, we start to come out of flu season." They're mocking him for that.
I contrast this with the Ebola outbreak. If you remember, the Obama administration really grossly under-responded. And in some senses, I understand that from a public health perspective. The threat of Ebola, because it actually doesn't spread very easily, was always incredibly low. And if you remember, the people on the right were just wacky. They wanted to, cut off air travel and everything else. What caught the Obama administration flat-footed was there was some bad protocol from the CDC, and some of the people that were providing health care to people that were brought here actually started to get sick. And then they got way behind the power curve and got a lot of criticisms, not because the response was wrong from the administration, but because they just didn't get out in front of it and said, we are addressing this. So here's the irony here. You have an administration, because I still think we're a relatively low threat. As a matter of fact, the CDC has even said that. This administration, ironically, jumped way out ahead of this. They've done a massive response. They've done a massive PR campaign. They've massively mobilized out of an overabundance of caution, and they got yelled at anyway.
Well, of course.
Because it's all politics.
But they made the right move. I mean, in terms of the travel restrictions, that was
absolutely
very inspired.
And if you saw I don't want to mention political parties, but people from certain political parties, which a week ago were furiously tweeting, attacking the president for travel restrictions and other message, are now deleting all those tweets.
Yeah.
Because now they're attacking him because he didn't do enough to restrict travel.
Disgusting cowards. I mean, so when you see this playing out, this seems like a moment of reckoning in some ways for Washington to consider the fact that in China we have single source manufacturing from so much of China that our supply chains, and there's a whole bunch of reasons that's a problem, including on the issue of trade. But now the issue of an illness that's spreading explicitly from China and is how disruptive it is to all the products that we buy as Americans. Is this a good opportunity for us to reassess how we handle global trade?
Well, first of all, I think companies are already doing that. The market actually works. It's called risk. You assess, what are the risks to my business? That I can get parts, that I can trust the guy not to steal my intellectual property. Yeah. And people have literally gone 180 degrees on risk assessments of China. There's a whole bunch of reasons to think that you need to mitigate risks of dealing with China as a sole source of everything in your life.
That's right.
And we're already starting to see people vote on that with their feet. One of the reasons why Trump's visit with Modi was so critically important is India is the world's 5th largest economy. And, like the United States, they largely follow the rules of the road. They're a much more dependable partner. When you hook up the Indian economy with the American economy, that's going to be a global competitive giant that anybody in the world can deal with. And I think companies are recognizing it's time to diversify. Now, the challenge of moving to India is the bureaucracy is still riddled with socialists. I mean, it's still very centralized, cumbersome governance, which is holding their economy back. When they figure that out, they will be a much better partner for the United States than China. And companies are already starting to think about what can we do to diversify our supply chain so we're not wholly dependent on a partner who maybe we shouldn't be wholly dependent on.
Right.
What do you make of this report of a whistleblower alleging that HHS officials deployed more than a dozen workers to two of the California military bases where they had evacuated Americans without giving them training or protective gear? And she claims that she was threatened with firing if she didn't accept a reassignment. And she alleges that the workers then who went to those two bases were then able to travel freely among the public.
Well, these are always difficult cases to evaluate because we don't have all the information. Sometimes whistleblowers bring important information to the public. Sometimes they're just incredibly disgruntled employees. This is not Ebola. Mm-hmm. So even if somebody wasn't properly trained, the kinds of measures and the actions you take are something anybody with a grade school education ought to be able to figure out. So even if there was a problem, I don't think that's it's something that's insurmountable. But
well, also there's a lot we can't control about this, but there are some things we can control. This is not the time for unforced errors. I mean, we should, government officials should be thinking clearly about, what are the proper protocols to how to deal with this.
And of course, this is there is perception and there is reality. And in public response to anything, whether it's a hurricane or, you always have to manage both.
Right.
Here's the thing. You cannot tell people who are afraid, you cannot tell them don't be afraid. Mm-hmm. That's just not going to work.
Have you ever tried that with your wife?
Yeah, I have. Thank you. I have a little petri dish right there in the backyard.
Right. Just relax. Don't get so worked up.
If anything, it exacerbates their fear, not just because they're afraid, but because you just told me I'm a coward. I'm stupid, and I'm stupid, right? Yeah. So the reality is it's a very messaging is very difficult. The message has to be credible. It has to be timely. And it has to be understandable. And I think that's the real challenge. But what's very frustrating to me is people are going bananas about what the president said or tweeted and everything else. And I'm like, go to the CDC website. If you don't like the president's tweets, don't be an idiot. Go to the CDC. Right. It could not be more clear. And when CDC said this is going to be a pandemic, all a pandemic means is the disease is in lots of places.
It also means it's new. It means it's something new that's transmitting.
But it's also a very scary word. You see it in movies, right? You hear the word pandemic in movies, and a lot of people die. And so I think the word pandemic in and of itself and the use of that word is really scary. And I think it scares people unnecessarily because they don't understand the real meaning. They get the meaning from the movie. Wasn't there a movie called Pandemic?
Yeah.
Right. And a lot of people die.
And all pandemic means is it's a contagious disease in lots of places. What epidemic means is it's a contagious disease that lots of people have. Mm-hmm. Doesn't mean they're all going to die because flu is an epidemic. We have flu season every year and it reaches epidemic proportions.
And aren't most flus are a coronavirus? They're just not COVID-19. They are. So would you test positive for coronavirus if you've had the flu?
No, because it's a different strain.
Because it's a different strain. Okay. So I didn't know if you would still test positive for it.
But again, I think that the challenge here is just go to the CDC website. The big headline, and this break with the president. So CDC says we may have to respond to this, and the president says relax, and they say that's a big problem. But if you actually go to the CDC website and they say, okay, what do you do?
Yes.
Social distancing, wash your hands. It's all the kind of normal stuff you do in flu season. They're not saying put a bottle on your head and hide in the basement.
Well, I have the bottle. I had him convinced, and I was going to put duct tape over the top and everything.
Yeah, thanks, Mary. And remember, in any panic, as always, stay tuned to FM 105.9.
That's right. James Carafano, thank you so much for calming everybody down. We appreciate that, and we appreciate you, making some sense of this and answering a lot of questions for us.
Well, thanks. This has been fun. I'm sure without the respirators, you guys are very attractive people.
Thank you. So glad somebody finally noticed.
I thought I was rocking it. Thank you so much, James Carafano from the Heritage Foundation.